All right, so I need a volunteer. Somebody who will talk to me because it's really hard to do fake conversation with somebody on how I'm doing an enrollment. So I
Sure.
just need somebody who's willing to jump in there and do it with me.
We'll do it.
You'll do it?
Sure.
All right, thanks, Jill. All right, I'm gonna make sure my health Sherpa is up. It is, okay. So Jill comes into my office or Zoom or voicemail or phone. My first question always is, how can I help you? So pretend like this is brand new to you, Jill. You're just coming in, you're thinking of retiring or whatever. You're not a renewal. This is a new appointment.
I'm sorry, am I turning 65 or am I,
No,
what's
no,
my age?
no, not Medicare.
I'm like, what am I doing? Okay,
So
so,
you're losing employer coverage and you need insurance.
okay, so nice to meet you. I am desperately needing coverage. I'm in the process of going through a divorce. It's going to be finalized in November, and at the end of November, I don't have coverage. How
All
can you?
right. So we need to get coverage for you for December 1st and then potentially into next year.
Yes, that's because I don't foresee myself getting a job anytime soon.
Okay,
So you
next.
need coverage for next year.
Okay. I'm going to pretend I have your form here, your intake form, and it's just yours. You're going to be divorced. I don't need to know what his is. I know you're still legally married right now. That's okay. As of November, you're going to be separated, so you will be filing as a single person for 2024. All right. So, what is your zip code?
78070.
And your age? Just
53.
53. All right. Household income is, we're just going to say 40,000. So the way the marketplace works is we tell them, I'm going to put this, share my screen now. So the way the marketplace works is I tell them what your zip code is because they want to know where you live so we can get the insurance companies that are in your area. We tell them what county. Looks like you have 3 counties. Is one of these, which one's the right one?
Comal.
Comal? All right. 53 years old, and then we tell them your household income. So the government says, all right, based on who you are, where you live, and how much income, they will make the second silver plan roughly 10% of your income. So they will pay whatever they need to make it roughly 10%. So here's what they're saying right now, $583. So that's what they're going to pay. I will show you in a moment what that means. But the reason we ask for your income is because they're telling you they're going to pay this ahead of time. So you're going to file your taxes for 2024. And if you have $40,000, government's like, great, even Steven, we paid the right amount, you paid the right amount. But if your income actually turns out to be 45,000, they're going to say, oh, we should have only been paying $516. You owe us the difference. Now, you only know the difference for how many months you used it for. So if we're only talking December, it's not a big deal. But if this was 12 months, they would say that amount, the difference times 12 or 6 months. So that's why we want to know your income. The reverse is also true. If it turns out you made 35, they're going to go, oh, we should have given you more. You should have paid less. So then they'll pay you the difference at tax time. Does that kind of make sense?
Yes.
Okay, so we want to keep it close. So I'm going to show you what the rates are. So we're going to put 40,000. They're estimating 583. That tax credit changes every year, but if your income stays the same, you're going to pay roughly the same each year. Now, every carrier, every year it changes, but it's usually in the same ballpark. So we've got 1, 2, 3, 4, 5, 6 plans in your area. Do you have a preference for doctor, or are you like, no, it's really about the benefit. I don't really care. I don't go to the doctor.
Well, I really don't care.
Okay. So it's more about the benefit as opposed to having to go to a specific doctor.
Well, I always like to keep my deductible lower.
Okay. So there are bronze, catastrophic, all the way to gold plans. Now, catastrophic, I don't even know why it's on here. That's for people that are younger. There's bronze. which we don't usually recommend because they don't, for just a few bucks more, you actually get better benefits. There's expanded bronze, silver, and gold. So I'm going to show you expanded bronze, and I'll show you the gold because I know you said that the deductible is the issue. So I'm going to scroll past a lot. There are 20 plans just in this category. So just kind of ignore that. My job is to look at all of these plans so that you don't have to. All right, I'm going to pull up a silver plan. And then the gold plans, which, you know, usually says it has the lowest deductible. Sometimes it does. But sometimes the max out of pocket is ridiculous. In fact. So before we dive into this too much, I have one question for you. Do you know the difference between the deductible and the max out of pocket?
Yes, I have to pay the deductible for most things until I reach that, and then everything's covered, usually at, you know, co-insurance until I hit the max out of pocket, and then the insurance company will pay everything after that amount.
Correct, unless there's a copay. So if there's a copay, you're going to pay the 40 bucks. That does not apply towards your deductible. That just applies towards this max out of pocket. But no matter what you spend, every dollar applies towards this max. So in a worst case scenario, this max out of pocket is usually the important thing to look at. Now, if you can see, this one has no deductible, and this one has a pretty small deductible, and the max out of pocket is less. Now, you told me you don't go to the doctor, you're pretty healthy. The price difference between that gold and that bronze plan, so you have $195.07 versus $26.78, is $168 a month. Now, we're only talking December. So worst case scenario in December, if something happens, you're going to reach that max out of pocket if you end up in the hospital. Would you rather pay $5,000, or over here it says $3,000 per day? So up to $9,000. You know, if you're in the hospital for a week, it's $5,000 versus $9,450. You're not saving a whole lot. You're only saving $168 for that month of December by taking the $26 plan.
Well, do you have anything else that would protect me if I went into the hospital?
We do. And I would talk about that for sure for 2025, because then you're talking maybe a whole year, but we're just talking that 1 month. So that's why I kind of want you to think, because you only have 1 month. December is a little bit different, right? Now versus doing it for a whole year. Because if you're doing it for a full year, let's assume we don't have those rates yet, but let's assume those rates are identical. $168 times 12, you'd be saving over $2,000 by taking this $26 plan. Now, a $0 deductible means everything's a copay. So you're going to know ahead of time what you're going to pay. So this plan over here has a 40% after deductible. So if you go to a specialist, you need to see a dermatologist because you have a suspicious mole. You walk in, they go, yeah, that's a normal one. Here, go buy some, ward off and you'll be fine. Here's your $1,000 bill because dermatologists are expensive. On this plan, you would pay $1,000. This one, you would pay $120. So you'd be saving money going with this plan. So these ones, if you look, I don't know if they make sense, right? The max out of pocket's the same. The copays are a little less for the specialist, but you said you don't go to a specialist. I don't know that it's worth paying $184 just to have a specialist copay less. I mean, if you wanted the gold, we're talking $11 difference, right?
Right.
So we could eliminate probably 2 of these, right?
Sure.
I mean, unless you want to dig into the Oscar, but again, you're paying more money for a deductible.
Well, I was just wondering what the EPO meant.
EPO means you have to stay within the network. HMO also means you have to stay within the network. So they're kind of the same. some HMOs in the old days, HMOs got a kind of a bad rap because you had to ask for permission to go to a specialist. Those are called gated HMOs. In our example, these are not gated HMOs. So you can still go outside of you don't have to get a referral for a specialist, but you still have to stay in the network. It will not cover out of the network unless it's an emergency or you're out of the area. It will cover emergencies. So if you're in Maine and you slip and twist your ankle really bad, it will cover that. But when you're in the area, you have to stay in the network.
Well, I know you don't do Texas, but HMO here, they are gated. We have to go get a referral. EPO, we
And that's
don't.
gonna say, every state's different. We only have one gated HMO and the rest of ours are not gated HMOs, so.
Okay, so if that's the case, if it worked, if I'm okay getting a referral, so let's lose Oscar and Christus.
Okay. Because I want to show that too, here's a bronze, here's a gold, $160 difference between the two. So let me show you this one. Let's go a little more detail of this one. So if you go to regular doctor, it's $40. It says $15. Now $15 just means you have to pay $15. If it's a $5 plan or $5 prescription, it's $5. But it's not, the insurance isn't going to kick in until it costs more than 15. So if it's $100 generic, I've seen generic antibiotics and it's $100. All right, you would only pay $15. The insurance would pay the rest. The rest of these in prescriptions, you would have to pay 45%. I know it says full price before deductible, but remember, deductible is zero. Now this one actually has an RX deductible, so it's $4,500 for that brand drugs and generics. So you would have to pay up to $4,500. Sorry about that, zero. $4,500 for these more expensive medications. Once you reach that, you would pay 45% or 50% until that max out of pocket. But you said you're not on any prescriptions at the moment. If you do end up with these, let us know. We can help search those coupons. A lot of the coupons for the manufacturer coupons are out there, so we can certainly help you find those. If you do labs, if you need an x-ray, it's $100. The $200 for an MRI is pretty good because MRIs are typically $3,000. This one, you're only having to pay $200. So that's why I'm talking about copays. When you have a $0 deductible for the medical expenses, you know what you're getting. Lab work is going to be 20 bucks. Now, sometimes it's $20 per draw, and sometimes it's $20 just to go into the lab. It depends on how it's billed. So be prepared if you're going to have 5 blood draws, it's going to be $5 times 20. Unless it's your annual, the annual ones are included in your annual. Here's urgent care, $100 copay, emergency room, $2,250. Again, you don't have to pay that if the bill's only $600 because you walked in, you cut your hand, you got stitches, you walked out. They're not going to charge you $2,000 if the bill was only $600. But the insurance is not going to kick in until your bill's over $2,250, which is a lot. I don't know if you've got that kind of money laying around. I don't. So I'm going to show you something that can help reduce that cost, because that's a big expense. And ER visits, the #1 reason for ER is still accidents. I know we kind of think heart attack, but it really is accident. Ambulance, it's 50% of the bill. I will tell you, ambulances do not usually have contracts with insurance companies, so you will get balanced billed. So the ambulance sends a $1,000 bill to the insurance company. The insurance company goes, well, we don't think your services are worth $1,000. We're only going to pay $500. You would get a bill for $250. And from that, that's what your explanation of benefits would say. Oh, you only owe $250. I can tell you right now, the ambulance will also charge you that additional $500. I have some coverage for that will help that as well, but just be aware you will get balanced billed for ambulances. Hospital stay, $3,000 per day, which is great if it's only one day, but that can add up. If it's hospital stay, the physician is 50% of the bill. So when the doctor comes around to visit you in your room, the charge is 50%. Outpatient procedures and the physician, $375. Those are those outpatient surgeries outpatient with the dermatologist, this right here is a huge savings. We're talking surgery, typically under $1,000 and definitely under 15. And I don't know any insurance outside of these $0 deductible plans where you can get an outpatient surgery for less than 15. So we typically think 375 for the doctor, 375 for the room, and 375 for the anesthesiologist. There might be a couple incidentals, but from what we see, from what patients have brought us, it's fairly inexpensive. Rehab, that's a little bit more. If you have to go to physical therapy 6 times, it's $120. You'll have to work with them. Maybe they can give you some stuff to take home, so you only have to do it 2 times or 3 times. Outpatient services, that's mental health, so counseling, $120. And if you had to have a baby, it would only be a $3,000 copay, which isn't bad, but I don't think you're looking for any children at this point, right? Now I'm going to check something. Whoops, let me roll back up here into the summary of benefits, because it is United Healthcare, and sometimes it's a little tricky. Here's the lab. So $20 for freestanding lab. Hospital, it's $150 copay. So sometimes when you get your labs done, they run it through the hospital. And that means the $20 bill you expected would be $150. You certainly can argue with that and ask for, when you get your explanation of benefits, say, hey, I didn't go to the hospital. I was just at the freestanding clinic in my small town. But if it is go to the hospital, the bill will change to $150 copay. Same with x-rays and diagnostics and those MRIs. $800 is probably closer to what you would get for an MRI. Again, significantly cheaper. MRIs are typically $3,000, but I don't want you to think it's going to be $200 and you actually get $800. I don't know of any MRIs that are freestanding if you're running it through a normal clinic. They just run it as if it's through the hospital. They have no charge for those for preventative ones, which is like birth control, and there's a few maybe heart medications and some insulin sometimes is considered no charge. The really cheap generics are $15, and then there's a mid-range generic, which would be a $65 copay, but the rest would apply towards that $4,500 RX deductible. So that kind of makes sense so far?
Yeah.
All right. So now I showed you those big copays, the ER copay, the hospital copay. Those aren't great. In fact, I didn't look, but it's, $3,000 per day up to 3 days, which would be $9,000. And then the insurance would cover the rest of it. Well, your out of pocket is $9,400. So you would have reached your max out of pocket if you're in the hospital for 3 or more days, but then everything's covered 100%. So I do have some very affordable plans. We have Philadelphia American Life. Their accident policy is only $32 a month. It would pay up to $4,000 per injury. So let's say your bill is $3,000 and you have to pay the $2,250. That Philadelphia accident policy would cover it. It has up to $10,000 for ambulance, which I talked about. You're going to get balance bill, no problem. That would pay that bill. They also cover dismemberment, though I suggest you keep your fingers and toes on your body. And it comes with an extra $100,000 accidental death benefit. So that's one of the ones that I would highly suggest. It's $32 a month. If we put that on top of your $26, you're still less than that gold plan, right? The gold plan was over $100. I also suggest critical illness for everybody. It's a sad statistic. 1 in every 4 women will develop cancer, 1 in every 3 men. Critical illness will also cover heart attack, stroke, organ transplant, and then you can buy it and now it's yours for life. So we have different companies that I can look at depending on which plan you want. Some turn 65 and it halves the amount because you don't need as much once you hit Medicare, and some will keep the same amount throughout the entire year. You buy a $50,000 policy, it's yours for life at today's age, not at 65. So it's not going up with age. Are you interested in some of those that I can show you?
So the premium doesn't go up. I paid the same premium amount.
For those critical illness and accident policies.
Oh yeah, let's see one. I'd like to see how much they are.
So I'm gonna assume it's $26, $32.52. I know, it's been a while since I've sold a pay like accident. I used to have those numbers memorized. And with your age, I'm gonna say that it's $45 for the critical illness. So for getting all of that, and we haven't even talked about dental and vision, we're talking $104 for all of that extra coverage, which is still cheaper than the $195 with that gold plan. We can add dental and vision. Are you interested in dental and vision?
Yeah, I guess I'm still, so what am I getting again? I'm getting, a 5,000 in hospital.
If we
Sorry, I
add,
can't,
we can add a hospital, a rider on there, which through Allstate, it's a
sorry, so
hospital
what,
rider. It covers you for accident as well and critical illness. So if you end up in the hospital, it's gonna pay that $3,000 copay that you have, right? It's an accident rider. Will also cover the ER copay and ambulance. And if you get dental and vision, all of that is cheaper, plus the major medical, you have the major medical, is gonna be less than that gold plan.
oh, okay, great.
So no, I could go into each plan, but we don't have time for all of that.
Okay.
That is typically how I'm running a new plan. I'm showing them the benefits on the major med, but then pointing out the big gaps, because there's a big gap. Now, I don't know about you guys. If you were healthy and I said, would you rather have a $195 plan, still have a $5,000 out of pocket, or a $26 plan, and then we layer all of this stuff that's going to protect you from your out of pocket, and it's less than the gold, which one you would be inclined to do? I've had people that want the gold and then they still do that. I'm not going to talk them out of it, right? It's their paycheck. Maybe they're like, well, heck, in their head, they had $1,000 is what they were expecting to pay because that's what Cobra was going to cost. And they're like, well, you know what? Why don't I just get that gold plan for 126 and I'll take the hospital rider and I'll take the accident and I'll take the critical illness and it's less than 250. And in their head, that 250 is awesome. So that's why I'm layering them. I'm showing them side by side, having them pick those plans. Now, yes, I would go into each critical illness and I would show them. I would go into the accident. Accident's pretty easy to explain. So that's why I'm kind of assuming they don't have any of those plans. So, sometimes they have on the intake form, I'm asking what their prescriptions are. So before I even see them, they're on insulin, then I'm gonna know I'm not gonna offer them something that a diabetic insulin would be a knockout. So you can't, we're doing a little bit of assumptions with Jill here that I've gotten her paperwork, I've seen what her prescriptions are, that she's healthy. If you get a spouse, a husband and wife, and one spouse is like, the list of meds is this long and the other one has none, you could put them in two separate policies and then say to the healthy spouse, here's how I can protect you. They almost always take it because they know what it's like with the sick spouse. Now, there are some guaranteed issue plans. I have that in another YouTube video that I did last year that are guaranteed riders. Allstate has a ton of guaranteed, and so does, and United Healthcare has an accident policy with a guaranteed critical illness on there. So you don't have to worry about the underwriting for some of those things. Now, it's not going to help them right now. If they are currently going through chemo, you're not going to be able to do that. But if they're going through chemo, cover the spouse. And I will tell you, the stress of a spouse for the person who's healthy because they're taking care of the sick person typically leads to health issues. Have you ever noticed when you're doing some of those underwriting, it'll say, is anybody expecting a baby? And you're like, well, this is just the man. I'm not trying to get a woman. It's just a single male. It doesn't matter. That's how stressful pregnancies are. They won't cover the male in a relationship if his significant other is pregnant because of the stress. And I'm like, wow, that's crazy. If your spouse is sick, you're statistically more likely to get ill. Now, you're not necessarily going to get cancer. If your spouse has cancer, you're not necessarily going to get cancer, but you're going to be sick. You're going to be wore down. Offer them that other coverage. They usually want it because they're dealing with the expense of that medication. And I really do wish, we're still hoping that first enrollment is going to be able to come back with their plan that they had that covered pre-existing and worked well. The problem is it's a supplement. It works like a Medicare supplement, and supplements are not allowed under 65. Who knew? Well, evidently, because that's something new, it's never been offered, it just isn't allowed. They are still with Congress, they're still trying to get it approved. We haven't heard anything, but, you know, there are some carriers, so there are carriers that have guaranteed issue. Physicians Mutual, if you sell Medicare, Physicians Mutual has guaranteed issue. They have guaranteed issue whole life. So there are guaranteed issue plans out there for those that are sick. So hoping that kind of made sense again, making assumptions that I have intake form and this person was healthy, right? Now, if I'm doing a renewal plan, I've already had that conversation. You should be offering those plans every time. Now, if you haven't, because for whatever reason, maybe you didn't know about these ancillary products or you were a little shy. Now you have to do it. You have a little bit harder work to do because when they walk in the first time, they're asking you to do all of this. They're saying, all right, I'm here. I no longer have employer coverage. I no longer have whatever. I'm here in front of you as the expert. Give me all my options. Now, maybe they're thinking health, but that's not all their options. You're the expert. So you show them, here's your health options. Here's the giant holes. I mean, it's great. It's guaranteed issue. You get your free preventative, but here's the giant copay. Here's the giant max out of pocket. Here's that dermatology bill, which is expensive because you have a suspicious mole. Well, if you know it's expensive, you don't go to the doctor. It doesn't service somebody. There's no benefit if they don't use it. But if you can say, hey, even if you go to that dermatologist, like I love Philadelphia Gap's policy, they pay 50% of the bill. Oh, okay. You know, I can reduce their premium or their copay. So your job is to give them a benefit they will use when they need it. So the renewal's a little bit harder. You're going to talk about, hey, here's your health plan options. How is it working for you? Did you have to go to the ER? No? Okay, good. Whew. I need to show you a product I found. It's really inexpensive. It's an accident policy, and it will help if you do need that ER. And then you give them a story of somebody who did. I use a lady that was one of my first people to use my accident policy. She slipped off the curb during the winter, broke her leg, had to go to the hospital, the emergency room. And the accident policy paid for the urgent care or the ER bill, the follow-up visit to have the cast taken off, and and her physical therapy. And she only had it for 2 weeks and it worked great. So I tell them a story. If you don't have your own story, you can find a story. I know of somebody who, and then tell them a story of how it could relate. Nobody had cancer. Nobody had critical illness. Great. I have a new product that I feel like I need to share with you. Why? Because statistically speaking, cancer is high. 1 in 4 women are going to get it, 1 in 3 men. So I'm going to show you a new cancer policy I found. And I want to get it into you because the lower your age, the cheaper it'll be. And we can lock you in at that rate. So you're going to have to use different wording on the renewals. If you have sold them, layered a lot of products, then you go, did you have to use any of them? How did it work? Because this is how you will get the feedback on those companies. So Sam thinks she's finally discovered Manhattan Life. One of the issues. We've run into issues with Manhattan Life, it claims, and it just seems like, what the heck is the problem with Manhattan Life? Yet I know many agents who love Manhattan Life, and it works for their clients. And so I'm like, what? I want to like them. They've got some really good benefits. They have a great short-term stay policy that is phenomenal. You should look at it. But I don't want to deal with claims. Well, it's from our feedback of clients, from talking to them, that we finally, or at least we think, Sam's discovered the magic sauce. Whatever reason, Manhattan wants a list of the doctors. Is it the last 5 years?
I think it's since whatever year of whatever you're claiming for, but I have been telling my clients, go back the last 2 to 5 years. No matter what, you have to include your primary care provider, even if you didn't see them. So they just want a list of your doctors, regardless of whether that doctor had anything to do with what you're submitting.
So who knew? That's well, that's easy enough, right? So those are the things. So when you're in your renewal appointment with somebody who you did layer, ask them, did you use it? And if they say no, go, whew, all right, good. You had a good, healthy year. That's what we want. Because it is what we want, right? We're selling them a product that we hope they don't use, except for their annual. Encourage them to get their annual. But if they have used it, ask them how it went. This is how I found out a woman who was having, she never told me, she had breast cancer in February, was having an issue with claims. And she's telling me in November because I asked her how it worked. And she should have gotten the product that she was in had this extra rider of $1,000 a day for treatment for cancer. And she had 40 days of treatment. And I'm like, dude, you're gonna get $40,000. And she's like, I don't know, it wasn't really working well. And then I had to dig and find, and she just never told me. And I'm thinking, this poor woman has been dealing with this all year and never asked for help. So ask them when you have that renewal, how did it work? So Jill, yes, what question do you have?
Sorry, which one on the PALIC are you using? Are you using the enhanced 24-hour accident or are you using the gap?
It depends on the policy. So we use that accident a lot, the 24-hour, and we always do the second one, because there's two options. One is 2,000 per accident and one is 4,000. I always use the 4. The price difference between the two is minimal. I think in all the years I've been selling it, and it's been a lot, 10 years, I've had one person that only took the first unit. But it's affordable. It is what it is. That rate hasn't changed since I started selling it. I do sell the gap insurance with HSAs. It's a brilliant one with HSAs. Sam and I both have it. We both have HSAs. The gap is brilliant for HSAs. The $0 deductible plans, it's not as good, but it's still a good plan because it will pay 100% for inpatient. So if I buy a $7,000 gap policy and I end up in the hospital, it's giving me $7,000. Now, if my bill's only $6,000, it's going to pay $6,000, but it's going to pay 100% up to, and then it pays 50% of outpatient procedures. But there's 2 different gap policies with PALIC. One is one type in some states and one is another in other states. And I don't know what state is which. The one in Wisconsin is the one I use. It makes more sense. Their other gap seems like it's not as worthwhile. So read the summary of benefits. If it doesn't, or their brochure, the one that we use has a picture of a bucket of money, and it's very cut and dry. 50% of outpatient bills, 100% if inpatient. It's very simple. So I will sell one or both depending on the situation. And I also sell that PALIC gap to groups. It's one of my favorite for groups as well, especially if they're a new group and they're trying to keep their premiums down. All right, they're buying an HSA. And then I'm like, put this gap on there. Just put the gap, because I don't want somebody to not go to the doctor because they're worried about the price. But the gap will at least decrease that price by 50%.
Yeah, they're just really expensive.
Sure.
So that's why I was wondering.
Yep. That's why. So it depends on the situation. The gap costs a little bit more than the accident. And as Stacy said, should I always go to expanded? Yes. Now, again, your state may be different, but in my state, when I compare a bronze versus expanded bronze, we're talking $2 difference. Why would I give somebody the bronze? A traditional bronze may have a copay for one thing, but for $4 more, you're going to get copays for specialists and generic prescriptions and stuff. So again, you're going to have to do some comparison. Your job as the agent, as soon as those rates come out, whenever they come out, typically the last week in October, is to jump on Health Sherpa. Sometimes you have to wait a day. So I'm at healthcare.gov because it goes to healthcare.gov first, and then it goes into the enrollment platforms. And I'm comparing. I mean, me and my staff, we divide up the carriers. You know, Josh looks at Prevea, Sam looks at CCHP, I'm looking at Common Ground, and we are looking at every one of those policies, and we're pulling up the summary of benefits. You have to pull up the summary of benefits, especially with United Healthcare. But pull them up. I made a YouTube video showing that, like why you would do it. I made one for my clients. Here is your summary of benefits. Here's what you should be looking for. So your job is to look at all 175 plans, whatever it is. That's your job. Look at them all, know the plans inside out so that by the end of the first week, you know them. And your job is to get rid of the ones that are stupid. So we have a carrier who we love. They're an amazing carrier. They have plan A and plan B. Plan B is exactly the same, but it adds vision. It's not a vision insurance. It's weird. I think they're finally getting rid of it. It's, yep, you got eyeballs. That's it. It's not the refractor. It's not helping you. So our job is to tell all our clients, don't look at that. And then when I'm showing them quotes, I never show them that because I went through it. And if somebody sees it, because I'm doing renewals, I'm sending out the link. And if I see somebody has signed up for that plan, I reach out to them and say, I see that you clicked this plan probably because of the vision. It's not true vision insurance. It's not going to give you glasses. It's not even going to tell you what your vision is. It's changed. It's just to see if you basically need to go get an eye appointment. Oh, okay. And so then I switch them to that. That's your job. Stacy says, which HMO is the best? That's going to depend on your state, your area. In my state, Molina, those state people that have Molina is an HMO. It's not gated. So in my opinion, a non-gated HMO is the best HMO. If you have a gated HMO, talk to the carriers, ask them how hard is it, talk to agents in your state and in your area saying, which one do you hear approves things better? So if you're in Texas, call the doctors that are in the network. I can tell you a for-profit will be a little bit less likely to have easy referrals. A nonprofit, usually a little bit easier, but each state's going to be different. Talk to your carrier reps and get to know your doctors. Call the billing department, call the specialist department of, ABC hospital in your area and say, I'm an insurance agent and I want to know for my clients, which are your clients, which carrier is going to be the best for those referrals? Which one has the best for accepting referral requests out of, from the carrier? So, Catherine said the Christus plan, there is no referral required, but Blue Cross Blue Shield requires referral, but they've got a good network, right? So that's kind of the thing. You have, this is why I don't know how agents can be specialists across numerous states. I just don't, not saying it's not possible, but I don't really think you can be. Unless you learn one state, like I know Wisconsin, right? I am an expert in Wisconsin. So maybe I know Wisconsin so well. So now I'm going to go, hey, I want to learn Michigan. They're my neighbor. And we have people up in the UP. So they're kind of Wisconsin. Maybe, so then I'm going to learn that state. But to be somebody who's selling across 50 states, I just don't see how you can do it. Now, I can read any plan. I can pull up a plan in Florida and a plan in Montana and a plan because I know how to read those plans, but to really know how they work with your carriers or your doctors in the area, that's what makes you the local expert versus a state nationwide expert. Looking through just quickly to see if there's any questions I can actually answer. So somebody said, what accident critical illness plan? I hate to say any specific carrier because again, your area is going to be different. I really like Philadelphia American Life. We've used Manhattan. Allstate has a really nice plan because if you do their accident, you can just add a critical illness rider to that as well as a hospital rider. I am going to dig into these more in 2025. Each carrier, I'm going to give you my opinion, show you pros and cons because there's pros and cons for each one. Life Secure, that's a pretty good plan as well, company. So there's lots of them. I think I mentioned this last week or the week before, if you need one carrier that does most of them, United Healthcare and Allstate, those are your two that's going to have a little bit of all of them. If you don't have time to learn 6 different carriers, that's fine. Pick United Healthcare, pick Allstate, and just use that for now. And then next year you can go, okay, maybe I heard this, ABC company's got a slightly better accident policy. Okay, you can add that later. None of these are bad. We're talking dollar differences between the two. United Healthcare Vision Plan cannot be beat. that plan is amazing. So if you sell a lot of vision, well, then get with United and look at their critical illness and accident and talk to your carrier rep. They will say, yeah, we got 18 accident policies. These are the 2 you really should look at. So if you really need to have just one carrier who's going to have all those different layers, those are the 2 that I would recommend, Allstate and United at this time. So PALIC, yeah, so this is one of the reasons PALIC critical illness isn't necessarily my favorite, because it does rate you when you get older. So maybe you signed up in your 40s, and then when you hit 50, suddenly it goes up, and then it goes up, and then at 65 it goes up, and the amount halves. So if I had somebody, which I did, they had a $30,000 policy, they hit 65, it went down to 15,000. That's not as great. Manhattan has a critical illness policy. You're locked in at that rate. Aetna has got one as well. So there are other, that's partly why I like to pick and choose. But often simplicity is what people want. They just want one carrier to pay. All right, you're going to pay for, United or Anthem or whatever on the marketplace, and I'm going to give you one carrier that's going to have your dental, your vision, your accident, your critical illness, So sometimes they'd rather pay a little bit more to make it simplistic and just stick it in there. And are we seeing types of claim issues for United Healthcare or Allstate? We have not seen claim issues. Typically with United Healthcare, once they're approved for whatever that policy is, their claims typically go through pretty easy. Same with Allstate. The issue that we have had is the network. It's the hospital system. It's getting the paperwork that they need. So that's usually what we see. But again, I only know if a client tells me. So that's why you need to ask them, do a yearly survey, not right now, but, find out every, a survey has. If so, how did it go? For you to help find out, because until they tell you, you don't really know. Is there anything else? We're kind of right at the top of the hour. No questions. So I hope that kind of made sense. I'm just trying to help you understand why you want to do it at the beginning, how you can find those holes. I know John, he's my age, John, and they're always pointing out that ER copay. Always, 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 always. Why? Because it's expensive. And it's expensive if they're in a regular plan, right? With a traditional deductible. Maybe it's less out of pocket. They're still usually going to pay 100% to the deductible and then a percentage. So an accident is a really easy way. If you're really nervous about how to do this, that's the easiest one to start with. Look at this ER copay. The second one is the hospital copay, right? If they are in that gold plan that I was showing, if it's got a traditional deductible and they end up in the hospital, whatever that max out of pocket is, that's what they're going to pay. For one night in the hospital, they're going to pay $5,000. Or if it's a $9,000. With the $0 plans, you show them what that copay is. $3,000. Ooh, capped at three nights. Well, whatever. The max out of pocket's $9,400. It's not saving them anything. They're still going to reach their max out of pocket if they're in the hospital for more than 3 days. So those are 2 really easy, giant medical debt holes in the plans that you're selling them. Show them how to fill those holes. Hospital riders, accident policies, really easy walkout. And as Steven Weinberger said a couple weeks ago, ask them permission. Can I show you some things that'll help fill those holes? They're always going to say yes. Unless they're like, nah, I got like $300,000 in this retirement reimbursement account that'll pay for all of it. Oh, okay. Yeah. You don't need to sell them an accident policy if they've got this huge amount sitting there. And they'll tell you, but just ask permission and they'll like, okay, yeah, show me how I can fill those holes. So thank you very much for everybody. Have a great mid-October. We got basically one more live session and then happy enrollment. So appreciate you all very much. Thank you very much.